Okay, so we're back, and we're back here at HIMSS 10 with our Better Health coverage, and so we're back. I'm sorry, I forgot your name again. Harry Greenspan.
I get that a lot. Yeah.
That's right. I'm sorry, it's been a long day. So from Dell, and so then everybody associates Dell with the high tech side, but as far as the health IT angle, what can you tell us what Dell's doing these days?
Well, sure. And first I'll apologize. We had a party last night, which is typical of HIMSS, and of course I lost my voice. We're from Dell Perot Systems. I was originally Chief Medical Officer with Perot Systems, so we certainly have a long legacy in health IT and being one of the largest health IT service providers. And of course, Dell has a long legacy of providing hardware solutions and services as well. Dell acquired us back in November, and now we're, for the first time, showing here together at HIMSS.
Oh, great, great. So you have some products that you're showing here this week?
Yeah, we unveiled on Monday that we've announced a partnership with the American Medical Association to help bring EMR solutions and the AMA's portal system to the little guy, to average practices with hosted EMR solutions, practice management, that sort of thing, with certified software and hardware that will move them along to meaningful use. On the Dell side alone, we have a series of things on mobile clinical computing. We've got an affiliated physician program and some interesting hardware stuff as well. So along with our HIE solution. So it's been a really exciting time for us.
Great. There's been a lot of talk about mobile this week. Can you expand a little bit about some mobile solutions that you have?
Well, one of the biggest frustrations, it's less the mobility of the products and the mobility of the providers, and that we have providers going from office to office and room to room and place to place. We want to make sure that they have a singular environment to work from, so that when they show up either with a smart card or some other system, that they can authenticate themselves, and what will appear on the screen is the computer as they last left it wherever else they were before. So whatever applications they had running, whatever they have access to, appears just as they wanted to. It's very convenient when you're going from an exam room to a nursing station, or you're going from office to office, that you don't lose your sessions. Plus it keeps you live where you are, and also turns off the sessions where you left.
Oh, great, great. And there's a bunch of EMR products out there right now. Can you tell me a little bit what kind of differentiates you from the other products on the market right now?
Well, we don't have our own EMR. We're actually, we're a vendor agnostic or vendor neutral organization. We host a number of different applications in our affiliated physician programs. We host about 5 different EMRs and are available to do others. And through our existing services, we actually support about 3,000 different applications. So we have experience in a lot of different areas.
Oh, great, great, great. Let's see here. So our friends in the chat room, they have feedback at this point or questions at this point? Sometimes deciphering comments can be
probably the first question is, why does Harry Greenspan sound like a 13-year-old boy? So
that could be the first question there.
Okay. How are you planning on bringing in MIDs like the Dell Mini 5 into the healthcare workflow? Do you have software solutions in place to take advantage of this mobility to compete against the iPad?
Well, I'd say the hardware stuff is really exciting, and certainly as part of the acquisition of Perot to take on Dell's capabilities in the hardware space is fantastic. We've got a number of great new products coming out. The Mini being a great one, but we have a number of between our ruggedized laptops and other sort of solutions that really make for a full complement of stuff. An issue will be the Mini 5. As far as I understand, we haven't had much releases about our specific applications that are going to be on it. It falls sort of in between. A sort of cell phone type of thing and a large tablet, which will enable the users to do a mixture of things, pull up different data, and be a useful sort of pocketable device to be used in clinical care.
Okay. And so in addition to that, you have other hardware type of solutions that you have?
Oh yeah, we got fabulous stuff, and we've got tablets, and we've got everything, and we've got smartphones coming out later this year, which were previously released in China. So I think you'll see if you take sort of the hardware that Dell is famous for, and you take the services that Perot Systems has been famous for, put those together, you get some really exciting solutions.
So it's a hospital and kind of an office-based setting, or are you focused on one area?
Well, we're the largest health IT services provider. So we're in hospitals, we're in clinics, we're in day spas. I mean, you name it, that's where we are. So we have enormous servers and data centers available for large enterprises, all the way down to what I sort of call a dumb box that you can drop ship to a small practice and have them hook it up to the wall and have all their applications hosted in a secure cloud. So there's nothing for them to do other than plug the machine in and not worry about security breaches or someone walking off with their data.
Great. Other questions?
It looks as if there's a question about whether you're doing anything interesting with the VA.
Sure. We have a long collaboration with the VA. We do both on legacy on the Pro side and from the Dell side. We worked closely with the VA. We're also involved in some of the information exchange between the VA and the private sector. One of the other things that we've done, the question may be asking more about Vista and our commitment to Vista. We are actually in the process of implementing Vista in Jordan right now, the country of Jordan, and we're seeing interest in other countries as well. So we've been a strong supporter of Vista and other open source solutions, and seeing how we can actually also help the VA further advance their technology.
Great. Other questions or comments from our friends out there?
They wanted to know more about day spas.
Surprisingly, medical. I'm an anesthesiologist by training. I've worked in large academic medical centers and community hospitals, but you'd be surprised where medical care is delivered. And they're doing laser skin resurfacing and liposuction in these medical day spas, and they need to be at the same level of standards for medical care and HIPAA compliance and everything else. So you'd be surprised what goes on behind the doors when the spa music is turned on. So, and I didn't actually mean it that way, but for those who are curious, you can follow me on Twitter at Harry Greenspun, Harry Greenspun, GREENSPUN. And I guess you're going to throw that out there as well.
Exactly. Yeah. So in addition to the Dell parties here at HIMSS, where can people find out more information, like the information on the show floor? Where's your booth at here?
Our booth is in 6445. We've got an enormous spinning Dell sign over it. We got some really interesting stuff we're displaying, not only our own stuff, but also some of our partners. And you can see a number of those things there, and we have a fantastic cappuccino stand as well. So that's been keeping everyone pretty fueled and fired up.
Great. One more? Okay.
Just for the folks in the chat room, interestingly, our plastic surgery friend does not feel that the day spas are keeping up with the standards there for surgical care. But the question is, prior to the acquisition of Perot Systems by Dell, Perot Systems used to provide servers from Sun and HP. Has this stopped and gone to Dell-only hardware?
Well, certainly, the integration is a process, and it's not like we're suddenly unplugging machines and putting new ones in. We certainly will do what our customers want us to do. The advantage now of being fully part of Dell is that we can provide really an integrated solution, and there's some real advantages both in pricing and other things associated with that. So I'm not saying we're not doing business with any other organization, but certainly this advantage of working with Dell when you're buying from Dell.
And if people want to find out more information, especially about these hardware products, where can they find that on the internet there?
Dell.com is certainly one of the highest volume sites on the web. And I think importantly, not only is it information hardware, but also we have a lot of content on there around healthcare, about uses, about making proper decisions about EMR use, and really beefing up the content that they would expect from Dell, having brought Perot Systems in and the sort of experience we bring there.
Great. So Harry Greenspun, MD from Dell, thank you so much for the time. Hope the voice comes back there for you.
Well, if I stop screaming, eventually it'll work out. So I think my kids will be happy about that.
All right, great. So that ends this interview here for Better Health. GetBetterHealth.com, and we'll be back in a few. So we'll see you later.
Thank you so much.
Okay.